Hi everyone, my name is Faiz. I'm a local disabled resident here in Tower Hamlets. So I'm here to talk about the health messaging that the council has or has put out there. Um, One of the things that the council have put out there is the 119 helpline for residents to get to book their jabs. As a person with a physical disability, um, someone that uses a wheelchair, I feel that the staff uh, need a bit more training on how to support people with different impairment types, and to sort of support them and advise them as to where they can go to book their so where they can go to get their jabs and various and to check, if the place that they're going, suits their needs and access needs. The other problem I had was that they didn't sort of understand the impairment. So for me, it was just a service that where I feel that the staff need to be more trained on disability awareness and how to kind of support different impairment types, i.e. a person in a wheelchair, you know and also other impairments. The other issue was the support or lack of support that you have uh, um, vaccination centers. The staff don't really know how to assist people um, at the vaccination centers. So that is another issue as well. But I guess it's all about training and about awareness of these issues. So if these issues can get ironed out, or if staff can get better trained, I think that would kind of help not only the local residents but also help the um, the local residents get the correct information, advice, support, whatever it is they need. So yeah, thanks for listening.
Hi, my name is Beatrix. I am a student at Queen Mary University of London and I am a young disabled person with multiple disabilities. I'm here to talk to you guys today about how I feel young people have been left out of the conversation around COVID, especially young disabled people. And this is something we can see across the pandemic. There's been quite a large conversation around how COVID affects older people and the resources needed to support older people and shielding and vaccinations. But with young people, with young disabled people, I feel we've largely been quite left out of the conversation. And it's really lovely and heartwarming to see that recently, if anyone's seen on the news, young disabled people, we're talking primary and secondary school age, have started filtering into the narrative with conversations around how they should best be supported. But again, there's this gap of around 18 to kind of 35 that is just completely being left out of the narrative here and very much left to fend for ourselves. And here are some things that I think would be really useful to me and to a lot of young disabled people if we had access to across the pandemic and going forward in future. So I think one of the big ones is information. Information about the vaccine was something that when you're when you're young and disabled, you're in with the initial cohort of older people, and there was lots of conspiracies flying around and lots of rumors and stuff like that, but there wasn't a lot of concrete information that was being fed out around how the vaccine will affect you, and where you can get it, whether you're eligible to get it. And these were things that are super important when you're in this kind of really dark spot with no one else around you getting it, maybe your grandparents. that really would help put a lot of people at ease. And kind of going further from that, once you're at these vaccination centres, lots of things around accessibility that became a real issue, particularly for me and for lots of other young disabled people that I know. For example, lack of seating in waiting areas, which caused flare up. For me, I had a flare up of my condition having to stand outside for so long to wait. Um, Also, a lot of for disabled people with mental health issues, that was another big one. The anxiety of having to go and stand in a queue of people and wait for something that you still don't have a lot of information or knowledge about was quite anxiety inducing and stressful for a lot. So that would be something that I think could be really important going forward, offering quiet times or special accessibility times for those with mental health conditions, autism or Asperger's, spectrum disorder, um, and special lighting times for people who are blind or people who are deaf or have hearing or visual impairments would be a super useful going thing if that's something that maybe earlier in the morning or once every few hours time slots that could have been offered throughout the day. Um, super useful. I think that going forward with this talk of the booster, again, lots of information to be offered to people in accessible formats where you don't have to go hunting for it, I think again would be super useful for so many people. For example, again, am I eligible for it? Am I not eligible for it? What do I need to know? How will it affect me and my condition? Do I need to speak to my consultant? All of these things I think would be super useful going forward in the pandemic to help young people feel more supported with their disabilities and to feel a lot safer.
My name is Mahendra. I am a blind and a senior citizen. My wife is also blind, and we live on our own in the Docklands in the borough of Tar Hamlets. The pandemic hit everybody, but it hit us, the disabled people, more brutally, and especially to the blind persons. We all live our lives with lots of restrictions, and there were further restrictions because of these problems of pandemic. Um, you know, we don't have the concept of social distancing. We can't manage with that. We need some support while walking on the road, crossing the road, or finding the door, but that was absent. So that created lots of problem. I had a very severe problem when I felt the symptoms of COVID. I tried to contact my GP. GP said I have to contact the special dedicated phone number of COVID. I tried them. They said they can't do anything. I have to go if I wanted to get tested. I couldn't go because we had no assistance. We couldn't travel in the road transport. So I again approached the GP. GP was kind enough this time and he tried to contact the COVID providers, health providers, and somehow he managed. So after a couple of days, our test was conducted. Fortunately, the test was found negative, but these couple of days were the most difficult days of our life, especially during this pandemic. So I think there should have been some provision of testing the vulnerable people at their home, and it should have been smoother and easier to contact. So these were main problems that I had. About information, I'm quite satisfied because I have access to the computer. I had access to social media and lots of news was available on electronic media. And the best thing was a regular newsletters sent by the borough of Tar Hamlets. Yes, we did have problem about shopping uh, because we were not sure whether whatever we are asking online, we are doing it rightly or wrongly. So we depended on our son, who from the distance he lives in the borough of Bromley near Kent. he used to order the online supply for us. Another problem was when the delivery man came, he left the stuff outside the door, and I had to browse with my hand to find that everything has been collected and got inside and then properly sanitized. So there's very few problems. I think everybody had this problem, but because of our disabilities, the problem aggravated. So my suggestion would be, in future, there should be some provision to contact the disabled persons and make arrangement for their test or vaccination more comfortable, more accessible.